We are live now. Good morning, one and all. I am Dr. Smarnika from IAP Digital Media team. I will be the host for today's webinar on third trimester exercises, a practical approach with resource person Dr. Joyner Mesquita. And this is being organized by Indian Association of Physiotherapists Women's Health, Goa. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of group of physios who handle the Zoom platform, webinar live streaming, and IAP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, YouTube, etc. Follow IAP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications of our live webinars. In the playlist section of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for their easy access. The social media links will be shared shortly in the chat. We will be having this webinar through IAP WC Goa. So I would like to ask Dr. Sadhvi to come ahead and give introduction of our speaker. Once that is done, our speaker will start with the presentation. Any questions that you people have, please put it on the chat box and we will take it after that. This particular webinar consists of practical demonstration as well. So if you have any questions regarding that, please put it in the chat box and we will take it after that. Thank you. Dr. Sadhvi, can you please take over?
Good morning to all. I'm delighted to introduce Dr. Joyner Mesquita, who is a women's health physiotherapist and also a head physiotherapist at Bump and Beyond Physiotherapy Clinic since 2017. Doctor has completed her BPT and MPT in obstetrics and gynecology from KLE University in 2015. Dr. Joyner has also been the assistant professor at Nitte Institute of Physiotherapy in 2016. Doctor is a certified water birth specialist since 2019 and has also won the National Healthcare Excellence Award the same year. Dr. Joyner is a lactation counselor and also a LAME's childbirth educator since 2022. Dr. Joyner is also the founder of Bumpy Ride, which is a 100 days postnatal transformation program at Bump and Beyond. We welcome you, Dr. Joyner. Over to you.
Thank you so much. Thank you so much for the warm introduction. We are a little delayed today, so let's get right on topic and we'll get started. Should I proceed?
Yes, please.
Yes, great. So today, am I audible to everyone?
Yes.
Great, great. So today we are going to get started with third trimester workouts. Today in this webinar, I'm going to cover these topics that you can see in front of you. The first thing that you need to understand when you're trying to train a mom who is in her last trimester is the impact that the pregnancy has had on her body, which is why we'll be looking at maternal responses to exercise as well as fetal responses, guidelines, safety measures, because safety is very important, especially in the last trimester. We will also look into the benefits of exercise, exercise prescription, and head straight to the exercise demonstration. I will be using majority of my time to explain the different types of exercises that you can use to train moms at this phase. Getting straight to it, let's get started with maternal and fetal responses to exercise. At any point, if you have any questions, please stop me and let me know. If I'm not audible, also do let me know. Okay. So first of all, we start with the maternal responses. There are the first one that is very, very important. During pregnancy, especially in the last trimester, you will see an increase in the cardiac output, increase in stroke volume, heart rate, and no significant change in atriovenous oxygen difference. This table is going to give you a detailed description of how the body changes between pregnant and non-pregnant, and this is something that's important because exercise itself has a lot of impact on the body. So we need to create a routine that is that considers all of these changes. So first one is going to be the blood volume that is increased. You'll see most of it is elevated. The heart rate is elevated, the blood volume is elevated, cardiac output. The only thing that actually drops is your blood pressure and atriovenous oxygen difference. So this is something that's going to drop, as well as your systemic resistance. That's because of added water weight that you have during your pregnancy. Now, coming to oxygen consumption, this one's important because it again affects workouts. Again, your exercise prescription is affected. So, your oxygen consumption as the pregnancy goes forward is going to be higher even at rest. So, when you are training a mom, you need to be very mindful about oxygen consumption because you don't want her to be huffing and puffing and struggling to breathe. So your workout needs to consider this. Coming to pulmonary responses, you can notice that pulmonary responses are actually better at moderate exercise compared to mild and maximal. So we always try to stick to moderate exercise during the pregnancy for more efficient ventilation. Coming to the next point, we are moving to basal body temperature. The core temperature during your pregnancy is going to change completely because, again, during pregnancy, you tend to feel very hot. Hotter temperatures are difficult to tolerate. And during exercise, again, your core temperature is going to increase. So, when you are training a mom in the last trimester, be very mindful about the room temperature. Try to have them work out in a temperature controlled room so that you are avoiding overheating and increase in the core temperature here. Now, physical work capacity, as you all know, the weight is going to keep increasing every trimester, which means that your physical capacity is also going to increase. So, physical capacity keeps increasing till the mom has reached full term, you can say. So, as the weight increases, so is the impact on the body. Sometimes moms even struggle to do the simplest of things. Moms to be struggle to do the simplest of things during this phase. Even daily activities become very difficult for them. Okay, now let's focus on the mechanical effects. Now, pregnancy itself is going to put a lot of pressure on the body. You can see a posture here, a correct one and an incorrect one. So, there is again a lot of weight that's there in front. So, you can see that there is increased weight of the breast, increased weight of the belly, which leads to a shift in the center of gravity. And this will cause increased lordosis here in case posture is not right. The implication of this is when you are in a bad posture, there is again going to be more strain on your back. So, when you're catering to an exercise routine, you need to be mindful about good posture. Now, during this shift of center of gravity, there's also going to be an increased risk of falls because of the imbalance that is created. So you need to be very cautious about the workout. You can't give a mom something that's very off balance or that is. You need to make sure that she's very stable during this time. Again, joint laxity is also something that is increased during the pregnancy because of the hormone relaxin. Now, coming to fetal responses to maternal exercise. Now, during this phase, there's a lot of impact on the baby also. So we try to keep a cutoff of 140 beats per minute. You don't want the maternal heart rate very high because it indirectly is going to impact the fetal heart rate. Even breathing movements seem to increase along with exercise. So as the mother is breathing harder, the baby is breathing harder too in this case. Moving next to guidelines for exercise during pregnancy. Now, these guidelines remain standard for all the trimesters. I'm just going to breeze through it before we get started with demonstration. So I've marked the points that are important in all the slides so it is clear to gauge. It is now the first question most people ask, is it safe to exercise during pregnancy? So today I'm going to cover a healthy normal pregnancy where there are no complications, the workouts that are safe for them. So the first question is about safety. So again, workouts are not going to increase your risk of miscarriage or low birth weight or early delivery. But however, it is extremely important to have this discussion with your obstetrician and have a clearance for it. So make sure your obstetrician is okay with you working out during your pregnancy. They will do all the checks and let you know whether it's safe to go ahead. Now let's talk about the benefits. So the benefits are, again, there is a tendency of reduced back pain because we are being, we have workouts that are going to focus on reducing the strain on the back, stretches, relaxation, all of it. Many mom to bees have seen an ease in constipation, again, because of the increased movement. Now, being active during your pregnancy can actually reduce your risk of gestational diabetes, preeclampsia, and even reduce the chances of a C-section. It'll Now, one thing that's very important is it'll promote a healthy weight gain. We don't want moms gaining a lot of weight because postpartum it is very difficult to lose this weight at times. So again, keeping them on a healthy weight gain bracket is very beneficial to a healthy pregnancy as well as to reduce complications like gestational diabetes. Again, there is going to be an improvement in overall fitness, and again, it'll strengthen your heart, your blood vessels during pregnancy if you are very active. It also helps you lose this baby weight after the baby is born. Now, very important question is how much should I exercise during pregnancy? So, what is the norm that we follow is 150 minutes of moderate exercise every week. So 150 minutes can be then split into 30-minute workouts on 5 days a week. So basically, aerobic activity is where you are moving your major large muscles in a rhythmic way. No jerky movements, rhythmic movements are what we focus on. Now, to understand what moderate intensity means is where you're moving through a raised heart rate and you start sweating. But you can talk normally. To understand this, we do a talk test where we talk to the mom to bees while they're working out. Okay, so while they are working out, we talk to them so we can understand if they are struggling to breathe or they're struggling to talk. So here we are focusing on a moderate intensity and 150 minutes. So you can then split it up into 30-minute workouts in 5 days or 10 minutes workouts through the day. This is an option in case a patient is struggling to do 30 minutes at a stretch. Okay. So again, examples of moderate intensity aerobic workouts is brisk walking and general activities like gardening. So if you now get started with a patient who is not used to working out at all, so you can get started with as little as 5 minutes a day and then keep adding 5 minutes every week until you are active for 30 minutes a day. This is how you can get started with someone who's never worked out in the past. If If you were very active before the pregnancy, you can keep doing the same workouts. Now, this is something that you need to understand with a person who is very active prior to the pregnancy. If you've been very active and you're comfortable with your routine, you can again talk through your routine. You are not struggling to breathe. So then we can again stick to keeping the same workouts, but a proper supervision is required. And in case you see that they are starting to lose weight, you need to concentrate on increasing their calories. Their calorie consumption needs to increase so that they are not losing weight during their pregnancy. Now, what changes occur during the pregnancy that can affect your exercise routine? So, these are considerations that you need to make. Like the first one is joints. Now, during pregnancy, hormones like relaxin are going to are going to cause the ligaments that are supporting your joints to become very relaxed. So, you need to make sure that you avoid the risk of injury and avoid any jerky, bouncy, or high impact movements that can lead to injuries. So have workouts that are very stable, very smooth and rhythmic, not bouncy or jerky. Now, balance. Balance is very important. We don't want anyone having a fall during a workout. So make sure that your workouts consider balance and the shift of gravity that we've already spoken before. This shift of center of gravity will place a stress on your joints, like your pelvis, your lower back. So you need workouts that are very stable and more and less likely to lose balance. So there is a lesser risk of falling. Coming back to breathing, when you exercise, oxygen and blood flow are directed towards your muscles. So, when we are working out, basically, we try to breathe harder in order to keep up to the increased demand of oxygen that our body has. The same way during pregnancy, also your breathing rate increases and your need for oxygen increases. So, as the belly grows, again, there's one more consideration, that is, the belly is going to grow upward, kind of putting pressure on the diaphragm. So, the uterus grows upward, putting pressure on the diaphragm, which makes it more hard for you to breathe. Now, what precautions do you take when you're exercising during your pregnancy? Okay, so first thing, you need to make sure that your patient is well hydrated, she is not dizzy, and she is not showing any signs of dehydration, like palpitations, dizziness. So make sure that she's well hydrated before, during, and after your workout. Again, wear support. So, wearing a good support sports bra is important during the workouts to give that added support. And even a belly support can be utilized if you feel that your patient is struggling to walk or run. Now, you need to make sure that your patient is not getting overheated. So it's very important to have a temperature controlled room. So if your weather is very hot outside when you're working out, make sure that your patient is in a comfortable setting. The room is not very overheated. Ask her to drink plenty of water and also wear very loose fitted, comfortable clothing so that she's not feeling hot or humid or overheated. And if she is feeling overheated, please take a break and let her settle down and then restart. Avoid standing still and lying flat on your back. So once you reach in your last trimester, you need to make sure that you avoid lying flat on the back, and also you avoid standing still for too long, because that again, standing motionless will cause blood pooling in your legs and feet. It will again hamper circulation. And again, when you're lying flat, it will put pressure on the uterus presses on the inferior vena cava, which again reduces the blood flow. So make sure that you are considering these two things during your workout. Now, what exercises do you avoid during your pregnancy? So, there are a few things that you avoid, like contact sports or sports that put you at risk of hitting your belly. Skydiving, again, very risky. Activities that may result in a fall, like snow skiing, water skiing, gymnastics, horseback riding. Again, activities that are in high temperatures, like hot yoga, hot Pilates, scuba diving, again things that activities that are performed at high altitudes. Again, those are the things that you need to avoid during pregnancy. I'm not going to read out all of this. Please take a moment to read through this. These are absolute contraindications. So if you have a patient who has any of these things, you need to make sure that they are not working out during their pregnancy, or they have a proper you have a proper conversation with them regarding these things. But these are the absolute contraindications. These are relative contraindications. Again, here you need to discuss this with them, and you need to have a proper clearance from their obstetrician so that you can go ahead. But these are relative contraindications to working out during your pregnancy. I'm going to move to the next one. Now, these are warning signs. Say you are training your patient and you see any of these signs, you need to stop your workout immediately. Okay, so these are again signs that you're looking for, like vaginal bleeding, painful contractions, leakage of amniotic fluid, dyspnea, dizziness, headache, or chest pain. Again, muscle weakness affecting their balance, or calf pain or swelling. These are signs to discontinue exercise. Okay, so I'm going to now move ahead to exercise demonstration. So we will get started with workouts. Okay, so so now coming to exercise demonstration, now there are a few goals during your last trimester that you need to consider. One is you're now at a phase where you want the mom to be very comfortable. You want your patient to be comfortable and ease through the last phase, because this is a stage where there are maximum physical changes that are happening. Apart from that, you also want to prep and prepare for labor. You want to increase her stamina for labor. You want to get her comfortable to give birth. So you need to have workouts that consider all of these goals. So we are going to get started first with breathing exercises. Now, these two breathing exercises can be used during the last trimester as well as during labor. So the first one is a slow rhythmic breathing. A slow rhythmic breathing is basically 8 breaths per minute. That is 2 breaths in 15 seconds. You are going to go for a very slow breathing. You can start with a cleansing breath like this. Remember, breathing is always through the nose and exhale is through the mouth. Sorry, inhale through the nose, exhale through the mouth. So you're going to do it this way. This is a cleansing breath that I'm demonstrating. You're going to go like, and then you get started. You keep a
Joanna,
timer.
you need to put your video on for this.
Okay.
Phone
I,
video will also do. If you can keep it in front, or else just stop the screen share, then we can see you. Yeah,
yeah, is this okay?
stop the screen share.
Yeah, I'm here. Can you all see me? Am I visible?
You need to stop the screen share, then you will be visible.
Okay.
You are still sharing the screen, no?
Can you see me
Yes,
now?
yes, yes.
Okay. So the first thing that you need to understand is you're breathing from the nose, you're exhaling from the mouth. Okay. So you take a deep breath from the nose, and this is how you're going. This is a cleansing breath. Then you place a timer and you're going to go for a very slow rhythmic breathing. That is 8 breaths per minute. That's going to go like this. This is a very relaxing breathing that you can practice during your last trimester. If you're stressed out or you're struggling to breathe, you can pause during a routine and ask them to do this. The second,
Okay, I was just reading the comments. Can you see her now? Can you can you see her now?
am I visible?
You are visible, joiner. Yeah. Can we start? So we have a little technical issue over here where we are not using the audio of the laptop, but of the phone. Yeah, you can talk.
Yes, sure. I can repeat the technique. I'm having an option saying that if you want to unmute, I'll cancel this, right?
Yes,
Okay. Can everyone see me now?
you're audible and visible now.
Great. Okay. So what you're going to do is you're going to start with a cleansing breath. That is, you're going to breathe from the nose and you're going to inhale from the nose and you're going to exhale from the mouth. Someone says they can't hear me. Okay, one.
No, no, you're audible. We can hear you.
Okay. So should I continue?
Yes,
Oh,
please. I'm watching that. No, somebody has written you're audible, so that's fine.
okay, great. So you take a deep breath and you inhale from the nose, you exhale from the mouth. So you're going to go this way. So your inhale is roughly 3 to 4 seconds. Exhale is again 3 to 4 seconds. No, sorry. Your inhale and exhale is roughly around 4 seconds. Okay. So you're going to go this way. You're going to time it on the timer and you're going to try to complete 8 breaths per minute. Okay. This is your first technique. And once you finish a minute, you're going to do a cleansing breath all over again. After this comes the next technique, that is fast breathing. This is something that's done when you're close to giving birth also. This is a breathing pattern which you can see when you're working out on a higher intensity. This breathing also can be practiced. So you're going to do a fast breathing that is 30 to 40 breaths per minute. Okay, so this again, you're going to start with the cleansing breath and then you're going to go for a 1 second inhale and a 1 second exhale. Okay, so you're going to go this way and then you start. Okay, this is practiced during the last trimester, especially for labor. Okay, Uh, Smarnika, can I go back to my presentation?
Yes, you can share the screen.
Okay, okay, great. But to demonstrate, I'll have to put it off, right, every time?
You can also read it out and demonstrate. That's fine.
Okay,
Instead
okay,
of showing, you read it out clearly and then go with demonstration.
okay, okay. I'll just put it on for a moment and then I will move to the next. Okay, is it visible? Yeah. Okay, so this is about breathing. Now we're moving straight to stretching. So as you can see, there are a couple of stretches that I have written down on my presentation. I will demonstrate each one of them for you. Second. Okay, I'm going to stop sharing. Okay, so the first thing that I'm going to demonstrate is neck circles. Am I audible and visible?
Yes.
Great. Okay. So the first stretch that I'm going to show you is a neck circle. Now, a neck circle basically is done to release any stiffness that's there in the neck. It's mobility as well as flexibility. So you're going to go all the way around. You're going to go all the way around and come down. So you're going to move through the whole range all the way around. You can go clockwise as well as anti-clockwise. Remember, you don't want any rotation. You don't want anyone rotating and then doing it. You want them to go all the way round. So this is your neck circle. This is the first stretch. The second one is neck stretch. Now, for a neck stretch, I will just stand and demonstrate now. Okay. So for a neck stretch, you are going to be standing this way. Your hand will be down like this, and you're going to gently drop your neck to the opposite side. If you want, you can also hold your hand from behind and drop your neck like this to make sure your shoulder is not elevated while you stretch, giving you a good stretch over here. Okay. The third one is a shoulder stretch. The shoulder stretch you can do against any wall. Okay, so what you do is you maintain one arm distance against the wall and you are going to stand with your arms this way. So you take your arms at one arm distance and then put your palms outward and you're going to just stretch. This will give you a stretch over here. Okay, you'll feel a stretch here. The next one is a side stretch. So side stretch you can do in two ways. One is you can go like this and like this. Try and touch your knees. So you're bending till you touch your knees and come back. Or the other way is you can take your arms up and go stretch this way and stretch this way. Okay, these are side stretches that you will be performing. Okay, the next stretch that I will be demonstrating is on the mat. Am I audible to everyone?
Yes, clear.
Perfect. Okay. Okay. So the next stretch that I will be demonstrating is a butterfly stretch. So all you've got to do is sit on the mat. You can have some support if the belly is, big. So what you can do is you can push the mat towards the wall and have some support. So she can lean here like this, and you place the feet in this manner. So she's got that support, and there is again no compression of the belly happening. Okay. The next one is the child's pose. Child's pose, you are going to Child's pose, you're going to again ask her to kneel, get on her fours, and then have a gap between the knees so that the belly isn't getting compressed. And you are going to go from on your fours and you're going to sit backward. Okay. This is again a stretch you can hold for 30 seconds. You go down and you go up this way. Okay. Again, the last stretch that I want to demonstrate is a calf stretch. So what you're going to do basically is you're going to, okay, I will just, yeah. So what you're going to do is you're going to place your leg forward and you're going to bend your knee, giving a stretch behind for the calf over here. Sorry. If you feel balance is an issue, like I just missed balance, you can have a wall around where you're holding on to something for more stability. Okay. Is this clear?
Yes.
Perfect. Perfect. So we're done with stretching. I'm just going to share my screen with everyone. Okay, so yeah, so we are done with stretching. Next, we are going to move to circulation exercises. Now, circulation exercises basically are very important in the last trimester because a lot of people are going to face issues like cramps, night cramps, pain in the foot. So, these are things that can be done to improve circulation. I'm going to stop sharing my screen. Okay, these I'm going to again demonstrate on the mat. Okay, so the first exercise that you're going to look at is a log roll. Okay, so again, you can either do it in sitting or you can do it lying down. Okay, but in the last trimester, we try to avoid any exercises lying on the back. So I'm going to demonstrate in sitting. So what you can do for circulation is you can do something called as a log roll. So this again will improve your circulation. This is your first exercise. The second one is knee bend. Okay, you're going to bend your knee and you're going to straighten, bend and straighten. You can also bend and open, come back, straighten, bend, open, come back and straighten. Okay, this is your knee bends. Third one is going to be the ankle. So you're going to do ankle circles. So what you're going to do is this. So you do ankle circles and you do ankle pumps. Ankle pumps is most commonly used to improve circulation. So ankle pumps and ankle circles. These are two for the ankle to improve circulation. Okay, now okay, so I'm going to again share my screen with everyone. So these are the circulation exercises. Now coming to cardio exercises, basically cardio exercises are again very important during the pregnancy to improve the stamina and cardiovascular endurance. So one of the great exercises is walking. So you can ask them to walk for around 30 minutes into 5 days a week. So walking is good. Again, relaxed walking through the day also is something that will improve their stamina because during labor, you are going to be asked to walk so that the baby kind of descends down faster. So walking is one important technique that you'll be using during labor. So practicing that in the last trimester can really help them while they are in labor. So walking, jogging, these are exercises that are helpful. One, yeah, so walking, jogging, these are exercises that are very helpful. Apart from that, what is very, very good also is swimming. So swimming again is one technique where they are going to feel weightless underwater. There is no stress on the joints. They are very relaxed. Again, your body is very supported in water, so there's very less risk of joint, straining the joints or feeling that exhausted with your workout plus overheating. All of those things are negligible with swimming. So swimming or any water workouts also can be done during this point. Now to make it a little more easier, sometimes it gets very boring to do just walking. So what we do is we give them different options. Like you can give them walking, you can give them jogging in one spot. If you feel balance is an issue, make sure that there is some support where they can jog in one spot. And second, what you can also do is give them side steps. So side steps will allow them to activate their inner and outer thighs as well. Okay, I'm sharing my screen now again. Okay, so now we are moving to strength training. Is it visible to everyone? Am I audible and
Yes,
visible?
yes, both visible and audible.
Great, great, great. Okay, so now I'm going to start with strength training. Strength training is, one second. Yeah. So, okay. So for strength training, again, there's going to be workouts that are, we are going to start with the upper body first. So there are going to be exercises with on the mat and with the dumbbells that I will be demonstrating to everyone. Okay. Okay, so let's start with knee push-ups. Again, knee push-ups are something that you'll again have to modify considering the pressure on the belly. So what you're going to do basically is again have the legs very wide, the knees very wide, sorry. So you keep the knees nice and wide. You go down in this manner. Again, you're at shoulder level, and then you're going to go one palm out. And you're going to go as deep as it is comfortable and come back. Okay, as deep as it is comfortable and come back. This is how you're going to do a knee push-up during the last trimester. Apart from that, let's look at wall push-up. Wall push-up is again something that can be done with ease if you want. If you want to be upright. So again, you go in this manner. Your hands are at the level of your shoulders. And then you go ahead and ahead. And you go in and you do a wall push-up. Okay, so this is how a wall push-up is done. Again, there's no pressure on the belly at all. Now we're going to get started with dumbbell workouts. So the first workout that we are going to do with the dumbbells is raises. That is lateral and forward raises. So lateral raises are going to be this way. Going to take the arm up. You can even do it alternately, or you can do it one at a time. Okay, these are forward raises. And the next one is lateral raises. So you're going to go up like this and down. Down. Okay, so these are lateral raises. Now we are going to focus on more seated workouts. So if you want to have your patient seated, this is something that you can do. Okay. Okay. So seated, you're going to have again a shoulder press. So what you're going to do basically is you're going to keep the arms at shoulder level and you're going to go up and you're going to come down. I think I will stand for this one for better visibility. Yeah. So what you're going to do is you're going to yeah, you're going to go from this position to straight and back. Okay, the next is going to be a reverse fly. So a reverse fly is something that you can do seated. So one second. Yeah. Yeah. So a reverse fly is something that you're going to do seated. You're going to sit with your legs wide like this, and you're going to go forward. Okay. This is a reverse fly. The next one is a biceps curl. You can have the patient seated or you can have her standing. This is a biceps curl. Yeah. First, you're going to ask her to lock her elbows nicely in the sides and then up and down. Up and down. This is a biceps curl. The next one is going to be a hammer curl. A hammer curl is where your wrists are facing, your palms are facing each other. So again, you're going to go down and up. Now, these two exercises are very helpful in carrying your baby after giving birth. So after giving birth, the biceps curl and the hammer curl are two exercises that will be very helpful for you in lifting your baby, holding your baby. Now, the last one for strength training in the upper body is overhead triceps curl. So what you're going to do is you're going to keep your elbow at your ear level and yeah, and you're going to go straight up. Make sure you lock your elbow and then relax. Straight up, lock and relax. So this is strength training for the upper body. I'm going to now share my screen with everyone. Okay. So this is strength training for the upper body. And lastly, we are going to look at lower body exercises. Now, the first exercise that you see here is squats. Squats again have variations and modifications that I will be explaining right now. Okay. So your first exercise is going to be squats. Squats again can be done as wall squats also. So you can again modify it accordingly. So you can have the wall as support. Yep. You can have the wall as support, have the legs a little forward, and you can stand in front of the patient and support her also, or give her a chair to hold on to. So you go down and you go up. You go down, and as you come up, you're going to lock your knees properly. Okay. Again, normal squat also is something that you can do if the patient is comfortable and has been used to it before. Okay, so you're going to go down and you're going to come up. You can even start with a mini squat and then progress to a deeper movement. Okay. The next one is a sumo squat. So a sumo squat, again, you'll be having your legs a little wider for this one. Remember, when you're doing a sumo squat, your feet Remember, when you're doing a sumo squat, your feet have to be wide and toes pointing out. Okay, you're going to keep your back straight and you're going to sit into a squat and up. When you come up, you're going to lock your knees. You're going to go down and up. Again, if balance is an issue, you can have a chair like this in front. Okay, so that the support is there. So you go down and come up for the added support. The next one is side lunge. Side lunge also, your legs are going to be nice and wide and you're going to bend your knee on one side and the other side. This will allow to open up your uh, inner thighs so that during birth this is a beneficial move. Okay, so you go in and out. Now, in case balance is an issue, again, you're going to move from here to here. Okay. This is a side lunge. Okay, the next exercises are cat and camel and glute kickbacks. Okay, yeah. So I'm going to again move to the mat. Now, being on your fours is a great position during pregnancy because there is less pressure on your diaphragm. So, this again is going to be very comfortable in terms of breathing. So, you can again incorporate the breathing exercises while you're in this position. The first one is cat and camel. So, again, you're on your fours over here. You're going to take a deep breath and you're going to arch your back like this. And you're going to exhale and you're going to curl your back like this. Okay? So, you're going to go this way. So inhale in cat and exhale in camel. Okay, this is cat and camel, which is again a very comfortable exercise in terms of breathing during your pregnancy. The next one is glute kickbacks. So what you're going to do is you're going to again start from on your fours, and you're going to straighten out your leg this way and come back and alternate. You can even do it on a single leg, or you can alternate it. Okay, this is a glute kickback. Okay, the next one is sideline. So in sideline, we are going to do sideline raises. So you're going to lie on the side like this. Okay, and you are going to bend the other leg down this way, straighten the one on top, and go up and down, up and down. This is one. This is sideline leg raises. The second one is clamshell. So you're going to again have both the legs bent like this. You're going to open up, you're going to come back. Open up and come back. This is clamshell sideline. And the last exercise for today is calf raises. So this again is very good for your calves. So if you feel balance is an issue, please hold on to a wall for support. Yeah, you can hold on to a wall for support. You're going to come up on your calves and go down. Up and go down. Up and go down. Now the intensity of every exercise is going to vary depending on each person. There is nothing that there's no all side no there is nothing where it fits all. You have to modify. You can start with as little as 5 counts per set, and you can go up to 15 to 20 counts per set. Yes, you can add a resistance band for clamshell. You can again modify. The thing is, this session is a very short session. There are a lot of modifications in terms of resistance bands, ball workouts. All of those things can be added. There are more modifications to each move. So you can add resistance bands to even your upper body workouts. So you're most welcome. So, what I want you to understand is that all of these exercises, the intensity again has to suit each person. So, you can get started with as little as 5 counts and then build up from there. If you feel that any exercise is very intense or difficult for your patient, automatically you can reduce it. During pregnancy, workouts are all about being in your comfort zone, moving within your range and not pushing yourself. So make sure that you are not, tiring your patient out, or you're not making her uncomfortable. Make sure she's very comfortable through the whole session. With this, I'm done for today. Smanika, you can take over.
This is going to be followed by a Q&A. So I would like to request Dr. Sadhvi, and also like to request all the participants, you can put your questions over here. Sugandha, if you need the PDF, you will have to mail to IAP Women's Cell Goa at the rate gmail.com. I'll be sending it over here. Can you please mention some exercises for core strengthening is a question that we have got. I think Sadhvi, please take over from
Yes.
here. I'm giving the email ID.
Yes, ma'am. Dr. Joyner, thank you so much for this informative session and also the demonstrations. There are a few questions. Can you please mention some exercises for core strengthening during the third trimester?
See, core is something that we don't really focus on during the last trimester because we want the belly to kind of relax and strengthen. And sorry, you want the belly to relax and kind of stretch, allowing the baby to kind of grow into it. So core is something that is very minimal during the last trimester. We don't really do like a lot of core workout. Uh, we usually do it earlier and then postpartum.
Okay, thank you. The next question is, how would you treat a pregnant patient with sciatica in the third trimester?
Okay, so sciatica is again something that you need to assess the patient first and then create a routine based on them. Definitely, the stretching and neural mobilization for sciatica can be done during this time, but again, you have to be very careful how you do it. And again, electrotherapy can be used like TENS for a sciatica case. Now, in this session, I'm not covering any of the I'm not covering any of the special conditions. We are focusing over healthy pregnancy only. So again, getting into something special would take more time. Maybe I can address this a little later. The sciatica question.
Okay. So the next question is, since most of the exercises are in quadruped, will the abdominal muscles go for weakness? I think that's what they are meaning
Mm,
to say.
Now when you create a routine, you need to mix and match things. You can't have like normally how people have no one day arm day, one day leg day. That doesn't work here. So you get started with a little bit of cardio when you start your routine, then you slowly switch between strength and ball, and you'll again switch between circulation exercises. So all of those exercises will be mixed around, so you won't be doing like a lot of exercises in quadruped itself. You mix between side lying to quadruped to standing to sitting, so that way there is no stress on the belly to a great extent.
Okay. Uh, what are some of the exercises for labor preparation? Is the next question.
Okay, so first of all, in terms of labor, we are going to first focus on breathing, because again, breathing is one important, exercise for labor. So breathing is something that I've explained already. A lot of exercises which have leg openers, they can be used for labor. At the same time, the one thing that I've not demonstrated today is a ball workout due to time constraints. So ball again is very, very good in terms of labor prep. So ball exercises, then you can do sumo squats, you can do the butterfly sit, you can also do a lot of side lying, because side lying is also a labor position. So few labor positions that are used, one is quadruped, one is side lying. These two, the exercises in these two can be used. Again, okay, so again, these are the things that you can consider in terms of labor prep, plus improving her stamina so she can sustain the hours of labor with walking and with cardio.
Okay, thank you. Can we give pelvic tilting exercise?
Yes, you can. You can give tilting during the pregnancy. It can be incorporated in standing also.
Okay. The next question is from a sports point of view.
Yes.
How do we train or modify the training from high performance pregnant athletes versus recreational athletes?
Okay, so when you are, first of all, the heart rate is going to be very different in terms of a high performance athlete. So, tracking your heart rate is very important, seeing how comfortable they are through a routine. See, some people are very comfortable doing workouts that are intense, whereas others will be struggling with basic things. So, again, you need to gauge their intensity first. At the same time, it's all about comfort in terms of your client. You need to make sure that they are breathing comfortably, they are moving comfortably. That is important. And again, you need to again consider the obstetrician's point of view as well, because they are again going to take care of your pregnancy. So they will also give you certain limitations which you can use to cater to your client specifically. So again, recreational athletes will be won't be able to do as much as high performance athletes. So again, you need to create a chart which tells you what they have been doing in the past, and then accordingly alter it to suit their current situation.
Okay. Thank you. How would you deal with inguinal pain while exercising? Is the next question.
Again, there are stretches that you can use for inguinal pain, which again I will address later. You can ask them to get in touch with me and I will give them the details.
Sure. Sure, doctor. The next one is if someone is practicing yoga since last 3, 4 years, so is it okay for her to do inversion asanas like Shirsasan in standing?
Um, yeah, see, inversion, again, circulation could be an issue. So in the last trimester, we would not want them doing that. So they can just, take that, they can kind of pause for those few months and then resume once, 3 months postpartum, you can say. But ask them to skip it during this phase.
Hmm. Yes. Thank you, doctor. The next one is exercises to avoid in mother with a lower cord.
See, again, now this is one situation where people, usually the obstetricians will ask them not to work out. They will ask them to, not put a lot of pressure, move. Like they'll be allowed to do exercises where they're walking around, but not a lot of opening exercises like stretching for the lower body. Basically, like butterfly stretch, all of that. They will ask them to take it a little easier. So it all depends on what your gynec allows at this point, also.
Yes. The next question is can we progress with therabands and sandbags, ball workouts?
Yes, yes, you can. See, ball workouts are a very good. They are very good in terms of relaxing your pelvic floor, relaxing your pelvic area. Again, as you sit on the ball, it opens your inlet 2 centimeters. So that's why it is something that is used during labor also, because it helps baby descend. It's also used to allow the baby to get into a cephalic position. So ball again is very good. Sandbags again, you can replace anytime. You can replace your dumbbells with sandbags. So definitely, yeah, it can be used.
Okay, thank you, doctor. The next one is can pelvic floor strengthening be done in the third trimester? And can you tell us some exercises?
Okay. See, pelvic flow is something that so I personally avoid pelvic floor exercises in the last trimester because of logic is what I would say. See, what happens is at the end of the day, when you are in labor, you're just 3 months away from labor in the last trimester. You want that pelvic floor to relax and allow the baby to kind of slip out
Easy.
nicely. So you want to relax the pelvic floor more in the last trimester, then strengthen it. So strengthening is something I would do in the first 2 trimesters and then resume after the birth, and kind of go very easy on it. You can do Kegels. You can do. There are 3 types of pelvic floor exercises that we do usually, but again, if you feel that the pelvic floor is very tight, because you can't assess the pelvic floor in the last trimester. So again, you don't want you don't want it to be very stiff. You want it to be relaxed while the baby is trying to pass through. You have techniques where you have quick contractions, you have long contractions of the pelvic floor. So what I would advise is to do only a long contraction, which is basically around 60 to 70% of the contraction for 10 seconds,
Okay.
and then relax after that. The quick contractions we don't want to do during the last trimester, but I feel that you should take it very easy on the pelvic floor for the last trimester.
Okay. Thank you, ma'am. The next one is what are the best exercises for mothers with gestational diabetes to manage sugar in the third
Okay.
trimester, knowing
Okay.
that the placenta is hypoglycemic?
Okay. So the one thing that has really worked is walking. So you can have them track their steps. You can make sure that they are doing a certain amount of walking after their meals. Okay. Now, few things that really work in terms of diabetes is one, the pattern of eating. You again start with fiber, then you ask them to consume something like curds, then their proteins, and then their carbs. So you follow this pattern, and again, after they finish their meal, you ask them to walk around for at least 10 to 15 minutes. Okay, especially 10 minutes. So you can split the 30 minutes in a day to 10 minutes after their meals, after each meal, covering 30 minutes that way. Now, there is no hard and fast rule that you cannot walk a little more. So, walking again during this phase, like mild intensity walking, can be advised to moms with diabetes, and you can track their steps. So they should be doing roughly around 4 to 5,000 steps at least in a day, which normally is easy to cover, and then track their sugars accordingly.
Mhm. Thank you, doctor. The next one is someone who's already a pregnant lady who's already into sports and used to lift 20 kgs during her first delivery with no
Mhm.
complications. How much weight should she train with for the second delivery?
Okay, so again, here it also depends on the duration between the pregnancies. Has she been active between these pregnancies? Has she maintained that, that in that, has she maintained lifting 20 kgs after that also? If she has, and everything has gone well for her, she can still continue to do so if she has no complications and her doctor's on board with it. And with
Okay.
doctor, I mean the obstetrician.
Mhm. Okay, thank you. Is jogging really comfortable during the third trimester?
Yes, it is. It is very comfortable. If someone isn't comfortable, then you stick to simple walking. If jogging isn't comfortable for them. And
Hmm.
if there are balance issues, you ask them to hold on to a chair and do jogging. Or you can stick to walking and side steps, which are easy to, follow.
Okay, thank you, doctor. The next one is exercises to avoid placenta previa.
Okay, so placenta previa is I don't really think you can exercise to prevent it. But once it's diagnosed, there are certain criteria that, the doctors, they will be very mindful about them not doing a lot of high intensity workout or moderate intensity workout. They want them to rest more. So again, placenta previa is one of the contraindications that I've listed on the list. If the person has read through it, they will know. So you have to treat it very carefully, and again, based on what guidelines the obstetrician gives you.
Okay. I think the next question is from education point of view. How can we join your pre and postnatal courses? What is the criteria for applying and getting any registered courses?
Okay. Um, at the moment, I don't have any workshops listed, but I'm planning one very soon.
Okay.
And I will keep in touch with you then.
Maybe they can email you directly to
Done.
ask
Done. You
about it.
can.
The next question is she is a primary mother, 34 weeks plus.
Okay.
4 days her baby position is breech position.
Okay.
Whether baby position will change, what kind of exercises can we prescribe? She's already doing exercises during the trimester. During that period, other medical are normal, values are normal.
Okay, okay. See, first of all, you need to understand that the heaviest part of the baby is the head. So, if a mom is active, she's walking around, there is a high tendency that the baby's position will readjust and the baby will get into cephalic. Now, few things that you can do. One is you can sit on the ball. Okay, so you start with simple bouncing or rotations on the ball. Second, what you can do is you can have the mom in a position where you start from a quadruped. I will just demonstrate this to you. Okay. Okay, so you start with a quadruped position. Okay, and you can get down lower. Okay, this way. So when you do this, again, your your belly position is opposite. Okay, so it allows the baby room. See, when you're here, you want the baby to rotate forward, right? So in this position, what happens? You're in a neutral position and the baby can rotate easily. At the same time, when you are in a seated position on the ball, Again, because of gravity, the head will tend to drop down. Now, if you want to align the baby's position, I usually start a month before the birth. So 34 weeks, 32 weeks is a good time to start. You can start with a ball routine where she's sitting on the ball for at least 15 minutes in a day. So that is something that you can start. Again, gentle rocking in quadruped position, the position I just demonstrated, that all of these positions can be used to help the head align. There are no guarantees, but we can definitely try, physically aligning the body so the baby adjusts.
Okay. Thank you. Thank you, doctor. The next one is, can a mother start exercising in the first trimester?
See, first trimester workouts are, most of the moms don't know that they're expecting at this point. So sometimes a lot of moms are working out during the first trimester itself. So once she gets to know about her pregnancy, you can ask her to be on an intensity that she's comfortable with, and maybe tone down a little, consider the different changes in the body that are happening, and adjust the routine accordingly. But she can exercise in the first trimester
Okay. Yes.
unless
Mm.
medically not advised by her obstetrician.
Okay. Thank you, doctor. The next one is, what are some aquatic exercises for labor?
Okay, this itself is one big topic, but yeah. Um, During labor, I feel like aquatic exercises are more for the pregnancy compared to for labor. During labor, you want that gravity. You want, because she's rarely going to be in the water or in a pool for labor, isn't it? So again, aquatic exercises are more helpful for the pregnancy rather than for labor.
Okay. Thank you, doctor. The next one is there any specific size of ball we can use in the last trimester for the
Okay.
exercises?
So remember one thing, when choosing a ball, when you sit on the ball, the hip and knee have to be at 90 degrees like this. When your hips are elevated, it's going to put more pressure on the knees. It's going to be uncomfortable for your patient. If it is too low, again, it's going to be uncomfortable because that grip and balance won't be there. It has to be a proper 90-90. So there is a chart that you can get online in terms of the ball sizes, which when you buy a ball, you'll get that chart. But this is what you're looking for, a perfect 90-90. So basically your hips and your knee are parallel, and then your knee and your feet are parallel. Okay, so this is the position you're looking for in terms of choosing the right ball.
Okay. Thank you, doctor. I think that's it for the Q&A, and you have done justice with all the questions asked. Yes. Over to you, Dr. Arya, for the vote of thanks.
Arya, you can take over from here. And I would
Yes.
like to inform that we in IAP Women's Health Goa are also planning a one-day workshop for the same, where we will be taking the trimester-wise exercise. It is just on the availability of the speaker, and once we decide that all, I will be putting it across all the groups. This is going to be an offline workshop though, but if we have enough number of participants who are interested, they can mail us on ipwomencelgoa@gmail.com, and we can also make it an online one at a much lower cost, but it will be a full day one. With that, Arya, you can take over.
Yes. Thank you, Dr. Sadri. Thank you, Dr. Smarnika. On behalf of the whole team at IAPWC Goa, I would like to take this opportunity to thank the organizing committee for the amazing planning and the execution of today's webinar. My sincere gratitude to our distinguished speaker, Dr. Joyner. Thank you so much for sharing your valuable expertise and enriching our understanding and our knowledge. I would also like to thank all the participants for the time, the interest in today's presentation. We hope all your doubts and questions are answered today clearly. Lastly, special thanks to our committee head and guide, Dr. Ruchi and Dr. Sanjeev, for this platform. Thank you so much, everyone, for being here today. We hope to see same kind of response and enthusiasm for our upcoming webinars. With this, we conclude today's session. Thank you everyone for being a part. Thank you so much, Dr. Jaina. Thank you so much, Dr. Smarnika, for this amazing opportunity. Thank you so much.
Thank you,
Thank
Arya.
you.
I would just like to inform before we close that this is a series of webinars that we are running, and we will be having other speakers like yoga therapist, psychologist, nutritionist, and then the entire postpartum journey on webinars. So I would like to personally thank Dr. Joyner to agree for this particular live demonstration that we had. Thank you, Dr. Joyner.
Thank you so much for having me.
Thank you all for giving your time on this Sunday morning.